Welcome to Just Mental Talk, the podcast that refuses to whisper about mental health. I'm Carl Bennett, your host of Just Mental. We are an independent platform, no charity badge, and no corporate sponsor, just an honest space for the conversations this country still struggles to have. Every week we sit down with the people doing the real work, clinicians, campaigners, politicians, and people with lived experience. We ask the questions polite conversation skips over, because stigma doesn't lift itself. A quick note before we begin: if anything in today's episode lands close to home, you're not alone and you don't have to wait until it gets worse to reach out. We'll signpost support at the very end of the show. So let's get into it. Today I am delighted to have Commissioner Chris Quinn from the Northern Ireland Children's Commission for Young People. My head went there. Welcome to you, Chris.
Thank you very much, Carl. Thanks for having us on to speak about this really important issue.
Chris, first of all, just a wee bit about you as a person. You spent pretty much your whole career. I'll not tell you how long Jill told me, your communications officer told me how long you spent, but you spent your whole career before your current role on the ground. The Star Neighbourhood Centre, the Bites Project, setting up Belfast First Youth Council, and 15 years running the Northern Ireland Youth Forum. What does a statutory commissioner's office do differently because you came up through youth work rather than policy or law?
Thanks for starting there, Carl. I suppose when I look back at my career, I'm very honoured to be in this role. You know, I left school in 1996, which for some people sounds like 100 years ago, but probably for people like you and I, it feels like a blink of an eye.
Yeah.
And at that time, we were just pre-Good Friday Agreement. There was lots going on. And as you say, I was working on the streets. So my very first job in youth work was on the interfaces in North Belfast. At that time, there was interface violence. But that's where I really learnt about social justice and participative democracy. You know, I often say my time volunteering in the community and then working in the community was my education. And it was my first real introduction to rights and to how communities can work together to make things better. But all through that time, there are many issues that I've been grappling with throughout my career. So poverty is an obvious one, and I'm sure we'll talk about that later. But throughout that time, mental health was always a big issue for children and young people. But when you ask the question of what's different about this role, I would say there are many similarities in terms of the issues that you're dealing with, the issues that children face and young people face and vulnerable families face. The real difference in this job is the statutory role. So the office here was set up in 2003 as part of the outworkings of the Good Friday Agreement and the institutions that would be set up to ensure a new dawn for rights and equality, I guess. So this office comes with certain duties and powers, and those duties include providing advice to government, powers to investigate and intervene. And I suppose that's the big difference there, that all of a sudden, through spending my career proverbially banging on doors, asking people to listen, now government really has to listen, and they have to take note of what I am saying and the advice that my office is given. So that's a huge honour, and I think it's that statutory role that is very, very special. And I would say that it's really important that people know that this office exists. Not enough people know about the United Nations Convention on the Rights of the Child, and not enough people know about NICCY and this office. So it's really good to have opportunities like this to tell people that we're here, and we're here to help and to promote and to safeguard the rights and best interests of children and young people.
And commissioners like yourself, Chris, I personally feel that someone like yourself who has had lived experience on the ground, so not coming from that policy or law background, but coming from the experience, I think adds a huge amount more weight into the benefits of what you can bring to that particular role, because you have been on the ground, you've experienced what it is for kids to face poverty, for families to face problems when the child has maybe taken their life by suicide, or maybe mental health hospitalisation. And being on the ground, I think, is a huge difference to just reading it or seeing it.
Yeah, I think so too. Um, I do feel really blessed to have followed the route that I followed in my career, but that wasn't by design. Well, first of all, I didn't do as well in my A levels as I wanted to. I wanted to get into teaching, but I think that was the universe telling me, look, we have a different path for you. And I do feel that those lived experiences do bode well in this kind of a role. And before I took on the job, I remember speaking to my predecessor, Kula Yasuma, who I'm good friends with Kula. We've worked for years together. I would check in with her regularly. But when I was starting on this new role, she said, "Look, Chris, just be yourself, be authentic, do it the way, just make this post the way you would do it." And I suppose that is my authentic self. I do feel like I am a people person. I like being on the ground. I think you need to be accessible. I think you need to be, accessible both to children and young people, but also to parents and communities. And those lived experiences, I think, are relatable, for people. And look, I engage with commissioners and ombudspersons from across Britain and Ireland and Europe, and a lot of those people do come from a legal background or a policy background, which is great. I have lots of respect for those people, but sometimes the feedback that I get is that because of my youth work background, it's very natural for me to engage with young people, and not all people have that background, which I think it is. It's something that is my authentic self, and I'm really, I hope that it works. I hope that people appreciate that.
Now, you talked about your career there very fondly, Chris, but is there a moment you think from your youth work years that still shapes how you approach this role today?
Yeah, look, I think back to my very first day as volunteer in the Star Neighbourhood Centre, and we had a rule in the Star, and that rule was, as soon as someone comes in, you offer them a cup of tea and a chat. Like, that's very basic.
Yeah.
It's very, very basic. But I suppose it's that first layer, that first, I think you need to be approachable. I think sometimes the best conversations happen over a cup of tea. Relationships, life is about relationships. I think that's the key thing. And whether I'm engaging with a young person or a parent or a policymaker, if the relationship is good, then we can do something positive. And often in my role, when you're engaging at that policy level or a political level, you're having difficult conversations. But I think if we go back to the very basics of why we're all in this role, whether I'm sitting talking to a politician, a policymaker, or a parent, we all want the same thing. We want the best for our children. And sometimes we're just coming at it from different angles. So I think, yeah, when I look back at my career, I think it's that first rung of like negotiation or you know humanity. We need to build relationships with each other, and it's just stripping it back to that very basic thing. That we're all humans, and that human touch is so so important.
Chris, I want to talk about a report that your office produced in February this year, I think it was, and titled "A System at a Crossroads." For those who don't know, what do you mean by system at a crossroads, and what made now the right moment to describe the system as being at crossroads, and more importantly, what actually is at stake in the choice being made?
Yeah, well, look, we started this bit of research uh, probably about 2 years ago, and what we wanted to do was look back at the previous report that was published by this office. So that was called Still Waiting, and that was published in 2018. And I wanted to see, look, what has happened since then, because you had COVID in the middle of that. Let's not
Yeah.
forget, and that has had a massive impact on everyone. But we thought, let's get a look at how far we've travelled since 2018. Let's try and get understand where the progress has been made, or I suppose more importantly, where the barriers are. We wanted to look at systemic as well as systematic, issues that have had an impact on young people's mental health services. And I suppose the title of the report, A System at a Crossroads, is acknowledging that we're at another juncture here, and we can, I suppose my thing is we can do something positive. Yes, there are many negative things there, and the report highlights, some of the barriers and some of the things that haven't been progressed. But I think with the right will, and back to that sort of cup of tea mentality, if there's a will, there's a way. There are good people in the Department for Health. There are good people in Stormont. The Minister for Health himself, Mike Nesbitt, has been a long time advocate for mental health services, and I've known Mike for a long time. I've had many a cup of tea with him and many a formal meeting with him, and he genuinely wants to see improvements. So I think we are at a crossroads, and with the will, there can be a way, and we can improve mental health services for babies, children, and young people right across Northern Ireland.
I know you mentioned COVID in the middle between the still waiting in 2018 and your report of this year, but how much progress has genuinely been made since then? Because COVID can be blamed for a lot, but at the same time too, people were still having to get on with their daily lives. Limited, yes, but politicians still could do things. So what progress has been made from 2018 to now, Chris, from the still waiting to the system at a crossroads?
Yeah, well look, there were 32 actions. I have them in front of me here. There were 32 actions in the still waiting action plan, and what we have done is we've color coded. I'll just show you for an example. This is how we monitor all our reports. So you'll see the color coding here. So of the 32 actions, there are 6 that are still coded as red. There's lots of ambers there, and there's a few greens. 1, 2, 3, 4 greens across those 32 actions. So a lot were amber, and we did see that progress had kind of stagnated, even in the last couple of years. And I suppose in the context of what has been happening since the publication of Still Waiting, well, the restoration of Stormont, that was a big thing, and we wanted to understand right now, Stormont is back up and running. What are their priorities? What has been happening during that period of closure, and what's been happening since it was up and running? So look, unfortunately, when we look back at the Still Waiting action plan, I was concerned that there wasn't the progress that we wanted to see being made. There were 19 actions identified as remaining at the same status as in 2023. So them things that kind of sat still, going upon what we had seen, when we were analysing what had happened since 2018 and now, and in the publication of this report. So yeah, I suppose it's frustrating. It's frustrating for us to see a lack of progress, and I suppose for people who are in crisis, for parents, for children who are on waiting lists, it's really not a great situation at all.
You mentioned waiting lists, and that brings nicely into my next question, Chris. Actually, when we talk about CAMHS, the Children's and Adolescents Mental Health Services, now Northern Ireland's CAMHS waiting time figures haven't been fully published now in over a year. While other waiting data within Northern Ireland has continued to be released in that same window. From NICCY's perspective, is that a technical problem or a political one?
From what we can see, a lot of the issues around data have been related to Encompass. So Encompass is and you'll know this, Carl, but I guess for the listeners and the viewers, it's a new dashboard. And it's a really good concept. And from what I have seen of it, so far it's got huge potential. So it will put all your data and your records in one place, and you will be able to see them, and parents will be able to see them, and professionals will be able to see them. So there has been, and I guess when we were looking at the System at Crossroads report, we saw that there was gaps in data, and that was frustrating for us to try and get that data. But a big part of the reason in that gap has been encompassed. Now, I suppose the good news for us is that since the publication of this report, we have met with Department for Health officials, and I'm actually due to meet with the PermSec this week, actually. And one of the things we'll be talking about is data. But I'm very hopeful that, that those gaps will be straightened out in time, and that a lot of this is to do with the outworkings of getting Encompass up and running. So I don't think it's out of a lack of will. I think it's to do with changing systems, and that has kind of hampered us on our research. But we knew that as we went along there would be issues with data collection, and it's been well publicised by others. The Public Accounts Committee and others have honed in on the need for up-to-date data and disaggregated data, in fact.
I think the frustrating for a lot of people within mental health circles, from what I'm hearing, is that data is being published from the Encompass system for many other different medical ailments, but when it comes to children's mental health in particular, that data is not being published, and I think that's frustrating for a lot of people. And I think that when we're asking politicians to do X, Y, and Z, or what we want to create through strategies or plans, we can't do that because we don't have the data to say, well, actually, here's where the greatest need is, or here's where the funding needs to be prioritised with. And when I spoke to a couple of our politicians on Just Mental Talk, some of them said that when they asked for data directly from the health department, they couldn't get it. But when they applied for an FOI, they were able to get it, which I think from a public's perspective, it's very frustrating because you don't know what is working, what's not working. And the Encompass system, I appreciate, is something new to the system, but it has been producing data for a lot of other things, but not for waiting lists when it comes to mental health, in particular children's mental health.
Well, look, I would agree with the frustration and the point that you make about FOIs. We shouldn't really need to use FOIs. My office doesn't use them, and I think it's really important that the data is available and up to date. That was one of the issues that we had in putting this report together. That by the time of publication, I suppose by the time of publishing any report, your data is going to be out of date. But yes, a lot of the data we were looking at was out of date, and Department for Health recognised that as well. That actually things have moved on a little bit more. But I suppose a big recommendation that we're making is about the need for up-to-date data, because look, you and I both know, if we want to design and improve services, it needs data is so important, and how we share data, how we collect data, how we share data, how we break it down, and sometimes there's, I would say, a barrier. Sometimes GDPR is seen as a reason why we can't share data, but we need to get over that. I mean, there's legislation. There's a Children's Services Cooperation Act, which mandates government departments to cooperate and to pool resources, and I would argue to share data as well in terms of the well-being of children. So yes, I agree with you, we need to get better at that, and if we are going to improve our services, it does rely on accurate, disaggregated and up-to-date data that is shared across disciplines.
You mentioned also earlier on, Chris, about poverty. Now, NICCY's February 2026 report, anti-poverty statement, I think you said approximately 25% of children, which is 109,000 children, in relative poverty. And you've described child poverty in Northern Ireland pretty much as a political choice rather than an inevitability. How much of the mental health picture is really a poverty picture wearing a different label, do you think?
It's a really good question, Carl. I think the first thing I would say is that I would stand over what I've said before about poverty being a political choice. Poverty is a result of policy decisions and where we spend public money, and there's been lots of talks around a childcare strategy. there's a bill going through the assembly at the minute on holiday hunger, and politicians can choose where to spend public money and how to spend it. In terms of its link to mental health, I suppose I would say that from my perspective, mental health doesn't, it doesn't, what's the word I'm looking for? It doesn't matter. Your socio-economic bracket doesn't determine whether or not you'll have a mental health issue or not. I suppose, social class, you could be mentally unwell and very well off, or you could be mentally unwell and living in poverty. But what I would say is the link between adverse childhood experiences and mental ill health are well evidenced. And if you look at the impact on poverty, on adverse childhood experiences, on unstable housing, even your physical health, hunger, holiday hunger, the living in crisis situations, or living in situations whereby your socio-economic status has an impact on your living standards, your access to health, your access to education. Those things undoubtedly have an impact on your mental health. They'll have an impact on stress and on trauma, and on how families are living and coping. So I speak with lots of children and young people who, for example, would be going to school hungry, who's, I suppose, this time of year, parents are struggling to maybe feed their children, who are struggling to put uniforms on their backs. So look, the UK is one of the most wealthy economies in the world, and I don't think it's acceptable that 1 in 4 children here live in poverty. I don't think it's acceptable that 18,000 children here are legally recognised as homeless, and those things undoubtedly have an impact on mental health, and in particular infant mental health and maternal mental health. So those things need to be addressed in the round.
And that, those are stark figures, Chris. You've quoted there, and and as you say, the UK is one of the wealthiest countries, and we're in 2026,
Yeah.
and those figures haven't got any better. And you mentioned about education. Where does education fit into that chain? Are schools currently part of the solution, or are we putting too much pressure on schools and indeed teachers and principals and so forth?
Yeah, I think schools are definitely part of the solution. I get what you're saying about putting pressures on teachers and principals. Um, I think, honestly, I think we need to have a massive change in how we view education. The education minister is pushing through lots of changes at the moment. I'm very concerned at the speed of that change, and I'm very concerned about how some of the changes may negatively impact children and young people, particularly those most vulnerable. So, we mentioned COVID earlier, and during COVID-19, there was massive there was a massive recognition that we ought to look at things differently, and we ought to look at well-being. I would say, and forgive me for going off in different directions here, but
No, it's okay.
the education system here is based on children obtaining 5 GCSEs. That's how DE determines success. That's not how I would determine success. I think we need to be looking at the success of a child in terms of their well-being, their mental health, their well-being, their coping skills. Children and young people for a long time have asked for a curriculum for life. They've asked for mental health as being part of what they're taught in schools. We need to be teaching children and young people about coping skills, about boundaries, about relationships from the earliest possible stages. And I just think we need a radical rethink on education, and in fact, the purpose of education. So Article 29 of the United Nations Convention on the Rights of the Child tells us that the purpose of education is about the child's talents and abilities and personal development and self-esteem and well-being. That for me is the outcome that DE need to be focusing on. And I think we're in this mentality of GCSEs, knowledge-rich curriculum. DE have just appointed a behaviours hour. I just think we're on the wrong track. We need to change lanes here and really think about what is the purpose of education, how is success determined, and for me, well-being is it's the cornerstone of any education system. And then, for those kids who are academically gifted and able, they will succeed academically. For kids who maybe want to choose a different path, that path should be there for them. So I just think it feels like we're stuck in Michael Gove education system. It feels like we've kind of put the car in reverse and we're going backwards very, very quickly. And look, I'm not denying that we need to change the education system. I think the pace at which the change is happening is too rapid, and some of what we're seeing are backward steps. And look, in terms of teachers, I see teachers and classroom assistants and people working in school canteens and people who are working as caretakers who are doing phenomenal work in terms of looking after our children and putting their well-being first. But they're under so much pressure. Teaching workforce is under so much pressure. And even how we test children and school league tables and things like this are really unhelpful. So sorry, I've probably went off on a bit of a rant there, Carl.
Oh, yeah, all right. Would you say that the Department of Education, they're not listening to you, Chris?
I wouldn't say they're not listening. We've got good, strong relationships with DE. I think what I would like to see more of is I would like them to press pause and maybe take action on what we're telling them. It's widely acknowledged that the speed of change is too fast. It's widely acknowledged that we have issues within special educational needs and disability. In terms of are they listening, I think they are listening. I get frustrated when I suppose the advice that I'm giving them isn't always acted upon. And that advice that I'm given would by and large be in line with what other people in children's rights or within education are given the department as well. So it does sometimes feel like there's a disconnect there. I would say that again there's good people in DE with good relationships in DE and the Education Authority, but it just feels that the system is so broke that we're kind of stuck, and we're stuck in systems that could continue to harm children. And that might sound really drastic, but some of the things we're doing just because we have been doing them for a number of years, and this is the direction of travel. And we need to evaluate for example, our SPINs working, our specialist provision in mainstream school is actually working, and there's no evidence. The EA has not produced the evidence that they say they're actually working yet. So there's a lot to grapple with.
And just to take you one step back again, just to talk about poverty and what you said there, Chris, as well. 1 in 4 children, and 18,000. 1 in 4 children living in poverty, and 18,000 children deemed homeless.
Yeah.
That's the politician's fault.
Yeah, well, I'm going to steal someone else's words here. It was Mark Bailey, who works for Homelessness Connect, I think is the organisation. But he described homelessness as a political failure. So if you put those two sentences together, that poverty is a political choice and homelessness is a political failure, they're big words, and I would stand over those words. It's not acceptable that 18,000 children are legally deemed as homeless, and it's not. I sometimes wonder where the public outcry is, because those, as a percentage, those statistics are huge. So,
Yeah.
and there are things that we can do. We can put in place homelessness prevention legislation. At the minute, the Minister for Communities doesn't want to do that. Um, but I would urge him to think again, because at the moment the Northern Ireland Housing Executive can only intervene once you present as homeless. But we want to prevent the crisis happening in the first place. We want to put support around vulnerable families before they present as homeless. And you look at the cost of living crisis, you look at the private rental market going through the roof. I speak to families all the time who have been made homeless just due to their rent prices going through the roof. I spoke to a family recently in Derry, and their rent went up to £1,000 a month for a very basic house, and they just couldn't afford it. And that family found themselves homeless. And I'm going, well, why are we not working to prevent that? Why are we not putting caps on private rental? Why are we not? I mean, during COVID-19, it was you weren't allowed to evict a family where there was children involved. And I'm going, well, why is that not just part of the law? Why is that not a thing? So, we can, with the right will, there is a way. And I just think that sometimes we're stuck. I mean, if you talk about poverty, our assembly legally have to deliver on an anti-poverty strategy, and they still haven't. The draft anti-poverty strategy that we've seen just isn't fit for purpose. There are no new actions. There is no budget attached. And where I'm at, if I don't see improvements to it, I will be calling for a standalone child poverty strategy, which was the position of this office, but we changed that position because we hoped that an anti-poverty strategy could include everyone, including children. But we may need to revise that position if we don't see big improvements.
But I think you're right, Chris, and I've been saying this for a long time, that I think our assembly, in fact, the political landscape pretty much across the UK and Ireland is one of reactionary. I don't think our politicians are very proactive in intervening early enough, which brings me on to my next question. And I'm once again a huge advocate of early intervention. I think it's so important.
Yeah.
But trying to strike the right balance, I think, is difficult for some people. So, what does effective early intervention actually look like from a mental health perspective? Like in practice, what sort of age do you think it's appropriate, and what kind of support? What does that actually look like?
Yeah, it's a really great question, Carl, again, because almost everything I look at points back to early intervention. You know, we need to, and for me, early intervention means um, intervening or providing support before crisis occurs. Because look, the way our systems are set up, we're tackling a crisis after it happens,
Hmm.
which is not only more costly, but it's more detrimental to people. So, what early intervention looks like, I think there's a few components to this for me. Um, I would like to see early intervention um, available throughout a person's life. So you don't know, I could experience a mental health crisis when I'm 50 or when I'm 15, So early intervention needs to work for everyone across the age bands, and it needs to be there pre-crisis. So we need to be able to identify the warning signs. We need to be able to identify, where adverse experiences are impacting people badly, But also, one of the things that I'm really passionate about is early intervention. I think we need to be supporting families from the earliest possible stage, and by that I mean when during pregnancy, So, and especially for those families that are most vulnerable, because for me, those things, if we get those basic things right and give, I mean, this sounds cliche, but giving children the best possible start in life. I mean, our government does talk about that, but what does that mean? So for me, early intervention means providing support at pregnancy, you know, prioritising for those most vulnerable, you know, so living in poverty, vulnerably housed. We need to remove the stigma. We need to, you know, the amount of mothers that I talk to who are fearful sometimes of talking about maternal mental health, and we need to remove that stigma. We need to talk more about perinatal mental health and put systems in place for families and for fathers as well. You know, I'm talking a lot about mothers, but for fathers as well. Um, and even when I look at the amount of, again, mothers who often have to leave work to care for their children because the system can't. Um, so I think I would like government to define what it means by early intervention. And again, I'm using words. I don't mean to sound like I'm using a lot of jargon or cliche, but you know how government and public bodies works collaboratively within itself. You know, so we often see these silos: health here and education here. But when I talk to the education authority, I'm saying to them, like, it should not be a surprise that when a child presents for school, at maybe preschool, say 4 years old, that a child with additional needs shouldn't be a surprise to the system. We should know that already, and in fact, we will know that already because, you know, health visitors and, you know, that intervention that exists in the early stages of life should give us enough information to prevent, you know, different kinds of crisis happening further down the line. So I'm not sure if I've answered your question, Carl, but
No, you have done, Chris, and I appreciate that. And I think you would also, like I, have welcomed the health minister's announcement about the mother and baby unit at the City Hospital with a deadline of 2029, even though my recent guest, Dr. Julie Anderson, and our Leah Flynn, the jury's out on whether it'll be completed by 2029, but the key of actually getting that in place where mother and baby's bond is so important, and mothers shouldn't be taken away from their baby when they're in a mental health crisis. Again, come back to that early intervention. So no, I totally agree with what you're saying, Chris. But also that early intervention that was brought about through the Healthy Happy Minds project that brought counselling into primary schools. It was stood down then in 2023 with nothing replacing it. Does that mean politicians or the DOE or as in Department of Education and others, they're not taking the mental health of our children seriously when they put something in place and then take it away again?
Yeah, and I remember the Happy Healthy Minds project well. It like all the evaluations clearly showed the impact it had, and I can remember when it was stripped back. I think the frustrating thing is there are many programs that work. I've seen with my own eyes, you know, and again I'm thinking about community sector programs where early intervention and support is available, where therapeutic intervention is available, where different methods of engaging with children and young people.
I think there's been big benefits, Chris, sorry to cross you, with play therapy and art therapy as well, not just with children but with adults. But I know that has become a big focus now too for some.
Yeah, definitely play therapy, art therapy, sound space is a thing.
Yep.
There's an amazing woman called Brona Stars who I would have worked with in the past, and a lot of her work is huge in terms of that, you know, that ability to intervene and to help avoid crisis and help work out of crisis. But yeah, the removal of Happy Healthy Minds was really regrettable. I think generally speaking, my frustration at a macro level is that I don't feel that decisions are always made with the rights and best interests of children and young people in mind. We argue strongly about adopting a child's rights-based approach to policy making, to public spending. And if we look at Article 24 of the UNCRC, it tells us that all children and young people are entitled to the highest attainable possible healthcare. The wording I haven't quite quoted correctly there, but I think you know what I'm saying.
Yeah.
You know, so we need to view how policies are made, how decisions are made through a rights-based lens. As I say, sometimes I find it hard to understand why there is the disconnect, between those making policies and the needs. I think sometimes, again, we're stuck in systems where we often, what am I trying to say? We're often pouring money into systems that we know don't work or are not effective. I think there's a real onus on our policymakers, and I mean at a political level and at a civil service level, to be brave, sometimes make unpopular decisions. And I know that those things can be really difficult. It's easy for me to, I suppose, advocate for this. I suppose if I'm thinking about Minister Nesbitt and I'm asking him to make hard decisions, what will be the consequence of those hard decisions? He will be the one that will face the wrath, But I think that's where we are. Lots of things here in Northern Ireland are stuck. I'm really sorry to say that we're failing children, in so many ways, with more children in care than ever before. My mind's going to the big review of children's social care that was carried out a number of years ago by Professor Ray Jones, and that has stalled. I mean, I know there's people doing work that there are strands of that children's social care review that are being actioned. And we've seen the big lottery, the national lottery, invest in family support, which is great, but we need radical change. That report called for a children's ALB. It called for big changes to be made around workforce. And I'm the children's minister, actually. One of the things that Ray Jones proposed was a children's minister. And that's because when everything's being negotiated and, when Stormont's up and running, I don't believe that children and young people are as prominent in the decision-making process as they should be. And our programme for government has showed that. I think it could be stronger in terms of in terms of how children and young people feature. And in fact, I've written to the head of the civil service to meet with her about that. But I haven't been able to get a meeting yet. But I want to talk with Jane Brady about the programme for government, and with a view to, with our next assembly mandate, how can we make it better?
You talked a lot there over the course, and I'm conscious of time as well, Chris, but of children's rights into law.
Yeah.
Now, NICCY has committed to working towards incorporating the UN Convention on the Rights of the Child into domestic law. What would actually change for a child sitting in Northern Ireland here now, the day after that would happen? What changes? And what is the biggest obstacle to that? Is it political will, or is it something more structural?
Yeah, I firmly believe that the full and direct incorporation of the UNCRC is the most impactful thing that our assembly can do for our children and young people.
Okay.
It would mean that every penny of government money spent would be assessed through a child's rights lens. It would provide a better framework for improved policy making, and I suppose for mental health services, it would lay the landscape for stronger early intervention, more access to information. The right to information is something that young people have talked a lot about. The right to high quality, timely mental health support. But we've seen in Scotland has fully incorporated the NCRC into domestic law, and we're seeing the impact of it. We're seeing that child's rights impact assessments are part of the fabric of how government works. Child's rights budgeting is part of how government spends its money, and we hear a lot about the pressure on the public purse, and that there isn't a lot of money. I don't agree entirely with that. I think there's money. I don't always think it's spent in the most effective and efficient way, and I think that through incorporation it would enable and it would mandate government to spend its money in a more effective and efficient way in the context of children's rights, and those rights extend across education, across health, across the safety of children and around the voice of the child as well, because I suppose that's one thing we haven't talked about yet. But we need to ensure that the voice of the child is central to all of this, and particularly with mental health services. I remember years ago in the Northern Ireland Youth Forum, we were part of the publication of the Elephant in the Room report, and it's still held up in Stormont around, some of the asks in it are still being called for, removing the stigma from memory, a mental health curriculum, and I think access to information were some of the big things, and we're still stuck there. We're still stuck in terms of transitions, we're still stuck in terms of crisis support, but the voice of the child, young people should be helping us shape the services. Young people who have been involved in mental health services can inform us in a way, and that's back to that lived experience question. And again, incorporation would make that legally, it's mandated in law that the voice of the child should be part of everything that we do in terms of the delivery and design of services.
We've talked a bit about youth work, Chris, earlier on there as well in your career previous. What do grassroots youth organisations, places like Yeeha in North Belfast, I know you work with, or I in Ardoyne, what do they see and do that the statutory system often can't reach? Yeah. And what would it take to properly resource that kind of community youth work that makes a difference? And I would say, and sometimes, and I'd be interested to hear your point on this, but sometimes probably saves lives too.
Yeah, absolutely. I've seen firsthand the great work that all those organisations do, and youth work steps in where statutory services fail. Youth work is life-changing, but for some it is also life-saving. And there are so many amazing youth work organisations right across Northern Ireland that are working really, really hard and delivering some of the most innovative, impactful work that I've ever seen. But unfortunately, they are the first to be cut. I suppose my very first contract in youth work was 6 months.
Right.
And that, I don't think it's that bad right now, but we have to move beyond 1 year, 3 year funding cycles. We need to be thinking 10 years. And I'm frustrated that we have a education authority funding policy which isn't fit for purpose. It's overcomplicated. There's multiple streams. I think it rules too many good youth work organisations out in terms of enabling youth work organisations to put proposals forward based on the actual need of children and young people. The Minister for Education has removed ring-fenced funding for youth services, which is really bad. Mm-hmm. We have a draft youth work policy which is really weak. I spent more than a day reading over it recently, and it's nowhere near what the last youth work policy was, and the last youth work policy wasn't perfect, but it really dilutes children's rights. It dilutes the youth work curriculum. It doesn't answer the big questions, so it doesn't answer questions about accountability and more long-term sustainable funding. So I just think it's frustrating that it's often youth work is called in, when things are going wrong, when there's riots on the streets, when we have mental health crisis, when we have flags protests, when we have racist violence. Youth workers are there. They're on the coal face, they're trying to diffuse the situation, but they're the people who don't know if they have a job often in 3 months' time, and that needs to change. So we need a better youth work policy. We need increased and sustained youth work funding, and I think I need to give credit to a lot of the big trusts and the big lotteries and people like that do step in. and keep these organisations alive. Full credit to them. But
I think a lot of local people too, Chris, because I would speak to, again, a number of charities, and they would face a lot of the same barriers that a lot of the youth organisations would, in
yeah,
that the barriers that are up to achieve funding is just ludicrous and puts a lot of them off even attempting to fund. But if it wasn't for the support by some of those big organisations you've mentioned, the National Lottery and many others, but also the local communities themselves
yeah,
who see the work that's being done and know the importance of that work, that preventative work being done,
yeah,
if it wasn't for them, these organisations wouldn't survive. And we've got to remember too that our statutory agencies are often referring people to these organisations,
yeah.
yet they're not prepared to fund them.
Yeah, and that was a big issue when I first came into post. There were issues around Department for Health core funding of voluntary sector groups, and that was being reduced. And for many organisations, they were facing closure or making lots of their staff redundant. And I remember having very frank words with the Department for Health PermSec at that time around the importance of core funding. And that's something I think that, you know, we can't, often funding is available for project work, but core funding is essential. Without the core funding, project work can't take place
Yeah.
because the organisation can't exist, in terms of the administration and employment of staff and having physical premises. So that core funding is really essential. And you're quite right. If you look at, I know you've talked about agencies like Action Mental Health on this programme, and if you look at PIPS and how that came about, and Lighthouse in North Belfast, you talked about Ardo and Youth Enterprises, and my previous employer, the Northern Ireland Youth Forum, and you've Youth Action, and you've all these amazing organisations, very, very committed people, and people who are in this work not for the money, because if they were in it for the money, they wouldn't be in
Yeah.
these organisations. They're in it because this is vocational. We care. We care. People like you and I, and people working in the sector, really care, and I think they have the knowledge and the creativity. And look, when I travel, I have the privilege of travelling to other countries quite frequently, and when I talk about our voluntary sector, I'm really proud, because in Northern Ireland we have something that is really special, and in many ways we're ahead of other countries across the globe. And when I talk about our voluntary sector here, I'm proud of having been part of that. But I think it needs more recognition and more investment. And I suppose that's where the hope comes. We
Yeah.
talk about being at a crossroads. We have the people here. We have the knowledge. We have all the evidence. Yes, we've gaps in data, and we've issues with funding, with political systems that aren't always stable. But we can do this. With the will, there is a way. And I would just urge our politicians to be brave. Let's start making really brave decisions. With 6 months of a mandate left, let's try and make decisions there. But like for the electorate, and again, I don't want to be party political, but when election time does come, talk to your politician about children's rights. Talk to them about how in the next mandate are they gonna put the rights and best interests of children and young people at the front and centre, and how are they going to put them things into their party manifestos.
Chris, and this is going to be a hard one for you, but just in light of a lot of what you said, and in light of the way we know government works,
Yeah.
and policymakers work, if you had to set just one measurable standard for children's mental health in Northern Ireland, something we could check on a year and say, right, okay, it either has or hasn't, is there one thing that you can say?
Yeah, I would love to see government coming up with an indicator to measure children's well-being. So we have a children and young person strategy. We have a Children's Services Cooperation Act, which talks about well-being, and we have all these indicators in education, mostly based on academic output. But I think we need, like, one tangible outcome I think we would achieve in a year is an indicator based on the well-being of the child. And we could we could anchor that within the Children's Services Cooperation Act, and it may strengthen that act, because at the minute that act isn't getting fully implemented. So yeah, I think in a year's time, if we got together, what date is it? 20th of July. Let's get together on 20th of July 2027 and see if we're any further to a well-being indicator.
I'll not hold my breath, especially with an election right bang in the middle of that. But and finally, Chris, what's the one thing you'd want a parent watching this or listening to this, currently on a waiting list with their child, to take away from this conversation? And what can NICCY do to help?
Yeah, well, I think, having worked very closely with people in that situation, I know how difficult it is. I know that how you and your child must feel at this moment in time. But I think despite all the challenges, just to reassure parents that there is help there. There are lots of amazing organisations in the community voluntary sector as well as in the statutory sector as well. I think once you're in the CAMHS system, it's really good. I can't say that strongly enough. I've seen with my own eyes how good CAMHS is. I think the problem is that waiting time is really detrimental. In terms of what NICCY can do, I think I need parents and young people to know that we're here to help, that my job is set in law to safeguard and promote the rights and best interests of your child. So my office and I are here to help, and I would urge you to get in touch. If you are in crisis, we mightn't always be able to help, but we'll be able to signpost. I have a team of lawyers here, so when things are really bad, we can litigate and we can intervene, and we can use the law to get the support for your children. We have a team of policy workers and a team of youth workers here. So please do get in touch, and you can do that. The easiest way to do that is by hitting our website, and we have a referral form, and that goes straight to our legal team.
What's your address, the website address there, Chris?
So it's www.niccy.org, NICCY.org, and when you hit that address, there's a small red button in the bottom right corner, and that brings you straight to our legal investigations team. But please do follow us on socials, get in touch. We're here. My job is to support and to safeguard and promote the rights and best interests of your children. So please don't be afraid to lean in.
Listen, that brings us to the end of this week's Just Mental Talk. My huge thanks to Commissioner Chris Quinn for joining us today and sharing and your honesty today as well, Chris. I really appreciate it. But I want to say that if something in this conversation has moved you, do one thing. Please share it with someone who needs to hear it. That's how stigma actually breaks. Not with hashtags, but with one honest conversation at a time. You'll find every episode on YouTube at JustMental25, on Spotify, Apple Podcasts, and across our socials at JustMental Brand. The full archive lives at justmental.net. However, before we go, if you're struggling today, tonight, or in the early hours of the morning, please reach out. Lifeline Northern Ireland is open 24 hours a day, every day, on 0808 808 8000. The Samaritans are there too on 116 123, free from any phone anywhere in the UK or Ireland. You don't need to have the words worked out before you pick up, they will. I'm Carl Bennett, this has been Just Mental Talk. This is not wellness, this is War Against Stigma, and we'll see you next week. Thank you very much.